Until a few years ago, vitamin D was a rather obscure nutrient. It was thought the main purpose of vitamin D was thought to help prevent certain diseases, such as rickets in children, which is caused by a bone malformation due to lack of sufficient calcium. And in adults, it's called osteomalacia. Now, vitamin D it was always known to be needed for the absorption of calcium. So it was thought that the main function of vitamin D was to absorb calcium, but it didn't do much more than that. And this was the belief for many years until a couple of years ago when they began to realize that there were vitamin D receptors, meaning there were places for vitamin D to interact with all over the body, including the muscles, the testes, the brain, everywhere. And this made scientists look into vitamin D more carefully. Now, vitamin D itself, you have to understand, is only basically what they call a prohormone. Bodybuilders and people into fitness are familiar with the concept of prohormones. They're basically substances that are kind of inactive until they're converted into more active. In the case of vitamin D is converted by enzymes in the liver and kidneys into a actual steroid hormone called 25-cholecalciferol, and it's measured by a lab test called 25-cholecalciferol. Now, the thing about vitamin D is they found that vitamin D, further research showed that vitamin D activates over 1,000 different genes. So vitamin D is a lot more important than it was previously believed to be. Now, vitamin D also is in the news, particularly in the last, let's say, 2.5 years, because of studies showing that vitamin D has a relationship to the symptoms or the subsequent events that occur with COVID-19 infections. To sum it up succinctly, what they found was that vitamin D, the initial study showed that vitamin D offered tremendous preventative effects against COVID-19 infection, meaning that the people that had a good level of activated vitamin D, and again, activated vitamin D is the hormonal form. That's the form of vitamin D that's been converted after you take it orally, or even if you're exposed to sun. It's converted in the liver and kidneys to this steroid hormone. I guess it's easier to just refer to it as steroid vitamin D. That's what I'll call the active form of vitamin D. In any case, what they call fairly higher levels or of the steroid form of vitamin D they found in these initial studies seemed to the people that had these higher levels seemed to be less frequently infected with COVID-19. But more importantly, when they unfortunately did get infected with COVID-19, the hospitalization records showed that almost none of them, or very rarely, progressed to the more serious forms of COVID-19, such as the form complicated by acute respiratory distress syndrome, where the virus creates I don't want to get too technical. It creates what they call a cytokine storm, where you get these immune proteins that get out of hand, and it started attacking, let's say, the lung tissue, where you basically cannot breathe without having to use a ventilator or a respirator. That's a very serious effect of COVID-19. And only about 10% of people who are put on those ventilators actually survive. Unfortunately, most of them die. And it's true that a lot of the people that wind up with the more serious cases of COVID-19 almost always have pre-existing risk factors such as cardiovascular disease, obesity. Obesity is a risk factor for COVID-19 because when you're obese and have a lot of body fat, you're already you already have a systemic inflammation because fat cells release over 100 inflammatory chemicals, and a lot of them, you're already in a high state of inflammation, even though you don't feel anything. So if you get infected with COVID, it accentuates the process where you could get that, dangerous side effects, winding up in a respirator and so forth. So, Anyway, what the latest studies of vitamin D shows is it's kind of similar to the COVID vaccines. What the newest studies show about vitamin D and COVID is that vitamin D does not prevent COVID. If you're exposed, especially the newest strains, the newest strains that are that came later, not the original one, the newer ones are much more infective than the original strain of, it's called the SARS-CoV-2 virus. It kind of mutated into various different strains. Unfortunately, mutated because a lot of people, didn't follow the rules. They didn't wear masks. They didn't get vaccinated. So, a virus in the wild, as they call it, meaning that it's all over the place. It circulates, tends to mutate, and that's what happened with COVID. The newest strains are very, very effective, and vitamin D was found to have little or no effect at preventing an actual infection, which coincides, strangely enough, with the actual vaccines. Most of the vaccines were designed to work or have preventive effects against the original COVID-19 virus, I should say. But the newest strains, again, are mutated forms that don't really match the original vaccine. Now, they've come out with newer vaccines. Now, what they're saying now is they've changed their tune. What they say now is that the current COVID-19 vaccines, they do not prevent infection. But what they do is they greatly increase the odds that you will not have to be hospitalized and you will not go through the more serious consequences of being infected, such as having to go on a respirator or a ventilator. In my opinion, that alone would justify the need to have these vaccines, because even if you still don't have that much protection against infection, if it does really protect you from hospitalization and death, I would say it's worth it. But of course, I'm not going to get into all the conspiracy theories about how people have died and all that. That's all not. I don't want to get into that. I'm talking about vitamin D here today. So what I wanted to get into is that because of all this research about the many health benefits of vitamin D, and they are considerable, vitamin D has become a very popular nutrient. It has a lot of features. It's very inexpensive. It's very easy to take. It comes in usually these little tiny gelatin pills that are very, very small. You could give them to a baby, it wouldn't have any trouble swallowing it. So it's a lot of people who don't even like to take food supplements, they will take vitamin D because they've heard of all the, they've seen these various videos and these blogs where they're touting the many possible health benefits of vitamin D. It goes way beyond helping to transport calcium into your body. Vitamin D, for example, and this is relative to COVID-19, vitamin D is needed to kind of activate certain immune cells called T cells, which work to help prevent viruses from causing disease. What that means is without sufficient vitamin D, your T cells aren't fully activated, and it's needed. Vitamin D is needed for the proper functioning of both the innate and the adaptive immune system. Those are the two basic forms of immunity. And of course, it's still needed for the health of the skeletal system. There's vitamin D in receptors that are in muscles, and they found that older people who are very unfortunately often deficient in vitamin D, because vitamin D is not found in many foods. It's found in some kinds of fish, a little bit of it's in egg yolks, but you have to eat a lot of vitamin D containing food to reach optimal levels. According to the lab value of vitamin D of 30 is considered normal. Anything less than 30 is considered a little bit deficient in vitamin D. If you go below 20, you're very deficient, but that's not the optimal level. 30 is just the amount to prevent deficiencies. If you want optimal levels of vitamin D, you have to get a vitamin D, and again, this is the activated vitamin D in the blood. The level would have to be at least 50 and up. 50 to 70 is considered optimal. About 60 would be about best. As I said, vitamin D deficiency is very common because it's hard to get in food. You can get vitamins. Vitamin D is actually the only free vitamin because you can get it from just exposing yourself to the sun for 15 minutes. Most of your upper body exposed. You can't be wearing any sunblock. It's harder if you have darker skin. It's harder if you're older. It's harder if you have too much body fat. But otherwise, if you expose most of your body to the sun for 15 minutes, you'll get the cholesterol in your skin will be converted from the ultraviolet rays of the sun into a form of vitamin D. Unfortunately, there's a caveat to that too. The sun has to be in this right part of the sky to emit the right wavelength, the optimal wavelength of UV light that'll convert cholesterol in the skin into vitamin D. And that's why, by the way, vitamin D is a steroid hormone, because steroid hormones means that the precursor, in other words, they're all made from cholesterol. So, like in northern latitudes back east, in certain countries where the sun isn't in the sun could be out, but it's not in the right part of the sky. You could be walking around naked, and you're still not going to get any vitamin D synthesis. So, vitamin D, again, about 40% of adults in the U.S. are considered to have insufficient levels of vitamin D. That's what the official statistics show. Personally, I think that a lot more people are what they call insufficient vitamin levels of D would be under 30. But I think that there's a lot more people that are actually I would put the figure more at about 70% of people really don't have a high enough vitamin D level to get maximal health benefit. 6% of the world population is also, 6% of Americans are considered to be outright deficient in vitamin D. Again, I would put the figure at higher. And around the world, vitamin D deficiency affects about a billion people. Now, what increases the risk of a vitamin D deficiency? Again, I mentioned the skin color, where you live, if the sun isn't in the right place, your ability to absorb vitamin D, such as if you have a lot of body fat, the vitamin D that you get from the sun will be sequestered in the fat. It won't get into the rest of the body. Certain medical conditions, diabetes and that kind of stuff, will have problems with getting enough vitamin D. Now, a lot of people will take the easy route, knowing that vitamin D is difficult to get from food, which is very true. I think the richest source that I can think of is something called irradiated mushrooms. These are certain types of mushrooms that have been exposed to ultraviolet light that have a huge amount of vitamin D in it. So, I don't know, I personally have never met anyone who eats irradiated mushrooms. I've never seen them sold in any store, so I don't even know where they exist. So you could say that vitamin D is difficult to get in food. I've seen some blogs where they say that it's overplayed, that vitamin D is easy to get in food, and they mention egg yolks. Yes, egg yolks do contain vitamin D, but to get optimal blood levels of vitamin D would require consuming at least 2 to 3 dozen eggs a day, and that's whole eggs, because the vitamin D is found in the yolk of the egg. Again, I don't know many people who eat 3 dozen eggs a day. I never have, and I never would, just to get vitamin D. It's ridiculous, because as I said, vitamin D supplements come in various strengths. The one I take is 2,400 units a D. The requirement for vitamin D, if I remember correctly, is only 800 units a day. This little pill, the tiny little pill, contains 2,400 units. I take 1 or 2 of those a day, and I take it, has to be taken with fat, because vitamin D is a fat soluble. Always take your vitamin D supplement with fat. But in other words, because of the popularity of vitamin D, some people overdo it. There's certain medical conditions where you're more prone to getting a vitamin D toxicity. These are what they call granular matter disorders, certain congenital disorders, some lymphomas, types of cancer, and then you can have a dysregulated vitamin D metabolism that they can automatically cause vitamin D toxicity. Sometimes people get vitamin D toxicity symptoms because of accidental overdose. They might take a little bit too much vitamin D supplements, or some people just take too much because they're convinced that, or they've read stuff that vitamin D is harmless. But no fat soluble vitamin can be considered harmless, completely harmless, because they all tend to accumulate to a certain extent in the body. Now, water-soluble vitamins like the B complex and vitamin C, they pass right through you. But fat-soluble vitamins are stored to a certain extent. The one that's least stored of all of them is vitamin E. You don't store much vitamin E. Vitamin D theoretically could be stored to a greater extent. It's very rare to see people with vitamin D toxicity from supplements. The medical name for it is hypervitaminosis D, or vitamin D intoxications. How do you know? Well, I just want to say I've had people come up to me and they've mentioned that they're taking 25,000 units of D a day in the form of supplements. A couple of people have talked about taking 100,000 units a week of vitamin D. Now, 100,000 units taking once a week is fine if you're already deficient in vitamin D. Because if your lab test shows that you're outright deficient in vitamin D, it would actually be a good idea to take 100,000 units once a week to build up your vitamin D stores to get you to the normal levels. But if you're habitually taking vitamin D and you take that much, you're going to get into a vitamin D toxicity situation. Now, how do you know you have excess vitamin D? Well, the first and easiest way to know is to have a blood test for vitamin D. You don't want it to exceed 100 nanograms. As I said, 30 nanograms, this is the blood test, 30, and it's called 25-hydrocholecalciferol. That's the blood test for vitamin D, and that's the activated form. The normal levels is 30, 20 to 30. 20 is a little low, usually 30. That's the normal level. That's not the optimal level. But if you take a lot of vitamin D, it might get to 100 or over, and that's when you're, if it's over 100, it's considered hypervitaminosis D. To get total vitamin D intoxication, where you get stuff like excessive calcium deposition in the body, all kinds of problems, that's called vitamin D intoxication, and that would be blood levels of vitamin D of 150 nanograms or more. Again, the usual suggestions, the optimal levels are 30 to 60 nanograms per milliliter. My last blood test that I had, I always have my vitamin D level checked. My last test showed that I had a vitamin 25-hydrocholecalciferol level of 59, which is pretty good. That's not bad for my age. And I don't even take a lot of vitamin D. I only take that one 2,500 unit capsule. I take one a day. I used to take two a day. Now I cut it to one a day because the reason I cut it, I have to admit, was kind of stupid. They came out with a study saying that higher blood levels of vitamin D are associated with an increased risk for Alzheimer's disease. And I got a little alarmed by that, and I cut it back to from 2 capsules of 2,500 to 1 a day because I was concerned. Remember, I have to take vitamin D because I don't go out in the sun much, and I certainly don't go out walking with my shirt off. So I have to get my vitamin D from either food or supplements. Not going to eat 3 dozen eggs, so I get it from supplements. That's why I take vitamin D. So I cut based on that study, I cut my vitamin D capsule to 1 a day, and then it turns out that it was a very flawed, bogus study that was exposed. Vitamin D does not in any way cause Alzheimer's disease. It was nonsense, but I'm still taking 1 a day because I think that's all I really need. I show a 59 vitamin D level, so that's enough. There was a case in 2020 of a 73-year-old man who developed vitamin D toxicity because he was taking 10,000 units of vitamin D a day for many years. Now, this is an interesting case because a lot of online so-called experts tell you that vitamin D is safe in amounts up to 10,000 units a day. My personal feeling is that because vitamin D is a fat-soluble vitamin and can accumulate in the body, I think 10,000 units a day is too much. I would put the maximum safe level between 5,000 and 7,000 units a day. Any more than that is just really not necessary. I can't see any point, again, unless you're deficient. There was another case reported in 2020. There was a 56-year-old woman who took an average of 130,000 units of vitamin D for 20 months because she read that vitamin D helps improve symptoms of multiple sclerosis, but she developed vitamin D intoxication. She had symptoms that included nausea, vomiting, and muscle weakness. When they looked at her vitamin D blood levels, they were 265 nanograms. I shouldn't be laughing. It's kind of sad. 265 nanograms. And as I said, anything over 150 is vitamin D intoxication. So what the experts, so-called, I always use that word in parentheses, experts, because a lot of what these people who call themselves experts say is just bogus bullshit. But anyway, what they say is that the upper tolerable limit of supplemental vitamin D is 4,000 units a day. I don't think that's true. I think you could take a little more than that. As I said, 7,000 to 8,000 is safe for most people, unless you have certain sort of genetic problems. And you'll know, because you'll get these, if you are retaining too much vitamin D, you'll get the toxicity symptoms. Another symptom of excess vitamin D, again, because vitamin D is needed for calcium absorption, if you're ingesting too much vitamin D, you're going to get elevated blood calcium levels. It's called hypercalcemia. The symptoms include digestive distress, vomiting, nausea, constipation, fatigue, dizziness, hallucinations, confusion, lack of appetite, excessive urination, kidney stones, kidney injury, even kidney failure. As kidney builds up, the kidneys accumulate too much calcium, high blood pressure, heart abnormalities. Calcium is needed for the nerve conduction. If you get too much, it screws up nerve conduction. And in the heart, that can cause heart arrhythmias or rhythm disturbances. The normal range of blood calcium level, according to the blood test, is 8.5 to 10.8 milligrams per deciliter. The people that get hypercalcemia from D usually get it after taking excess D for a long time, usually over at least 6 months or more. There was this 2015 study that was an older man who had already had dementia. He was taking 50,000 units of D for 6 months, and he was repeatedly hospitalized with symptoms related to hypercalcemia. Again, so that's another sign. If you show really high levels of calcium in a blood test, you should cut back on your vitamin D level. Or you could be taking too much calcium supplements. That can cause it too. If you take too much calcium without other minerals, such as magnesium and also vitamin D, you can have problems. So nobody needs to ingest more than 1,200 milligrams of calcium a day. You don't really need more than that. So most of the symptoms of side effects of vitamin D, excess vitamin D, are related to excessive calcium in the blood. There was a woman who experienced nausea and weight loss after taking a supplement that was mislabeled, because it turned out that the supplement had 78 times more vitamin D than what was stated on the label. So she went into hypercalcemia. That's a problem with food supplements. Unfortunately, a lot of them they're problematic. They're not properly labeled, and that's another story. So there was a boy who developed stomach pain and constipation after he took, again, improperly labeled D supplements. And his brother experienced elevated blood levels of calcium without the other symptoms. So excess vitamin, or I should say hypercalcemia, can alter mental status. They can get symptoms like confusion, depression, and even psychosis. In extreme cases, you can go into a coma. There was a case of a 64-year-old man who accidentally took 200,000 units of vitamin D per day because he misunderstood the medication instructions. He showed altered medical status and other symptoms related to hypercalcemia. He was agitated and confused for the first 10 days of his stay in the hospital, but his symptoms gradually improved as his calcium levels dropped, and it took about 18 days for his calcium to return to normal levels. Hypercalcemia can cause kidney injury and kidney failure, again because of the excess calcium. It can definitely harm the kidney filtering units, and hypercalcemia can cause the blood vessels in the kidney to constrict, which not only leads to decreased kidney function, but also damages the kidneys and can lead to permanent, possibly even kidney failure. So, it's very hard on the kidneys having too much calcium or vitamin D. Let's see, what else can I say? I think that's about it. Yeah, I'd say that's about it. So the bottom line is that the main problem with excess vitamin D is the is the excess calcium deposition in the body. I would also state that, to be safe, if you're taking large amounts of vitamin D, such as when I mentioned the 5,000 to 7,000 units, that's fairly larger amounts. I think it's really a good idea to also take a vitamin K2 supplement. Vitamin K2 ranges, it has various forms of vitamin K2, ranges from K4 to K7. If you take the K7 form, it's retained in the body longer. You can take it every other day rather than every day. But what vitamin K does, it helps to regulate vitamin D metabolism to such an extent that you don't get excessive calcium deposition in soft tissues, including the blood vessels. So if you're taking higher amounts of D, you want to take at least 100 units a day of a vitamin K2 supplement. You also want to ensure an intake of other nutrients that keep calcium honest, so to speak, and prevent it from winding up in places like soft tissue where it should be. Calcium should be in bone. It doesn't belong in soft tissue. A little tiny amount of calcium circulates in the blood. That's needed for nerve conduction, muscle contraction, but any more than that can cause calcium deposition. So you want to take minerals that'll help prevent that. The chief one is magnesium. Magnesium will also help prevent calcium deposition. And for magnesium, you want to take a minimum of 400 milligrams a day. If you're active or under stress, you want to boost it up to 800 milligrams a day. So, and always remember, don't forget, when you take a vitamin D supplement, always make sure you take a form of fat. It could be as little as a pat of butter, tablespoon of a fish oil, or some extra virgin olive oil. Because if you take vitamin D with a glass of water, it'll pass right through you. It's not going to be fully absorbed because it's fat soluble. It needs fat to be absorbed. So that's about it. If you want further information on nutrition, exercise science, anti-aging research you can use today, effective fat loss techniques, ergogenic aids, hormonal therapy, supplement science, which supplements work, which ones don't, women's health and fitness. I write information that's very useful for women too. All of this is included in Applied Metabolics. www.appliedmetabolics.com. It's 30 to 45 pages every month, no ads, just solid evidence-based information that includes my over 60 years of experience and empirical knowledge. And also academic, because I've studied this. I read about several, I don't even know how many medical journals I read every month to find information that I could put together in popular language for Applied Metabolics. When you subscribe, if you want, send me an email, and I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, and general medicine. I have an email portal on my Applied Metabolics webpage, where current subscribers only can send me short questions about anything they might have read in Applied Metabolics or anything pertaining to nutrition and exercise science that comes to mind. I will answer that as a bonus because I appreciate your subscription to Applied Metabolics, and this only applies to current subscribers of Applied Metabolics. I don't answer unsolicited questions. And you're welcome to leave comments under the video. Hopefully they'll be nice comments. Trolls will be ignored. I'm not going to respond to any troll comment. Most people are nice, which is good. But if you want to leave a comment where you have a suggestion for a possible future video topic, I will take that into consideration. And if I think it interests enough people, I will do a video on it. And also, if you find my videos are informative and useful, please subscribe. It's free. I think there's some sort of little subscription tab you could press or something like that. And I think when you do that, they'll send you a little email every time I post a new video. You'll have notice of that. But just for your information, I do post new videos every Tuesday. Every Tuesday there's a new video. It's the Jerry Brainham channel on YouTube. And please, if you see this video, please let others know about it. As you noticed, I'm not pushing any products other than my newsletter or my publication, which is not expensive at all. It's less than a cup of Starbucks latte, so the thing is, it's very inexpensive, and I'm not pushing any products. I'm just giving useful, truthful information. If you feel that other people might get benefit from this, please refer them to my channel. So thank you for listening. If you want to have the best friend you'll ever have, you'll get yourself go to your local shelter and adopt a dog. I have my little 23-year-old dog, Bruno. He's about 2 feet away from me. He's lying on a couch here. Bruno's had a couple of health problems lately, but he's still going. He's blind and he's deaf, but he's still going. He's an amazing little guy. We could all take a lesson from this dog that loves life. Take care.